In 2011 and 2012, I had the pleasure of co-chairing the Canadian Nurses Association's National Expert Commission along with Dr. Maureen McTeer from Regina, whom I'm sure many of you know, and has been very involved. In fact, Susan just mentioned that she replaced her in her position, so you should have perhaps asked Marlene if you wanted something very specific with respect to the Canadian Nurses Association. And I don't pretend to be a nurse, but I now know more acronyms than is imaginable in the nursing and medical professions. And you people have more acronyms than we lawyers do, which is something to aspire to, I suppose, in the longer term. But Marlene and I spent a year and a half co-chairing and working with a very talented group of people from the CNA and also people who had volunteered to help us on the National Expert Commission. And in our final report, which was presented in Vancouver 2 years ago, come this June, our group spoke directly to the role of IT and related matters in the assurance of high quality, timely, and accessible diagnosis, treatment, and ongoing care for Canadians, including those who, because of distance, and in a country like ours, that's not an insignificant number of people, because of distance from major centers, have been historically underserved by the healthcare system as we know it. Our report and everything related to it, including the research, the polling, the submissions that were sent to us by email or in public meetings are all available on the Canadian Nurses Association's website, and I do urge you to, doesn't sound like an author, I really urge you to read it. Unlike an author, it's free. You don't have to go and buy the book. So I do hope that you'll go on the CNA website to read the report. Our recommendations acknowledged several systemic issues that should concern all of us. I mention only two here. First, there is a troubling mismatch between health spending and results in Canada. Now exceeding $200 billion nationally, annual healthcare costs account for nearly 50% of some provincial government budgets. Second, there is a need to focus on what can make a difference. One of those areas, of course, must be electronic health tools that will allow us to perhaps avoid some of the tragedies that we heard of briefly earlier this afternoon. Our report held that increasing Canadians' access to health, electronic information, and services must be a priority for immediate and ongoing action to address issues that have a substantial impact on the health of our population, individual quality of life, and, although we hesitate sometimes to talk about it directly, the cost to our healthcare system. It was evident to all of our National Expert Commission members that this action clearly reflects public priorities as they were told to us in our commission hearings across Canada, the priorities that Canadians hold for healthcare and health system change. We set forth, after public consultations and meetings, a report that was a call to action, a call to ensure the sustainability and the relevance of the Canadian healthcare system and its ability to meet the urgent and the changed realities of what healthcare means and what is needed by Canadians. In these findings, the National Expert Commission joined our voice to those of other groups, organizations, public bodies, health departments, urging a fundamental transformation in how to meet the healthcare needs of Canadians today and going forward. We had 9 recommendations, and I'll briefly just mention them to you here. Our first recommendation was that Canada be in the top 5 on 5 critical areas within 5 years. Second, we urged the provinces to increasingly work towards putting individuals, families, and communities first. There was a view among many of the health professionals, rueful in some instances, that often the system and those within the system liked to have it so that they were the focus, and their needs and their timetables and their schedules were what was important, and that the patient was kind of an add-on, if you will, to the whole. So the whole idea of putting individuals, families, and communities first was a critical second point. The third was that we must finally implement primary health care for all. We must, as a fourth point, invest strategically to improve those factors that, in fact, improve health. We know that many of the research that is done and has been done over the past decades, that the healthcare system is but one component, and sometimes not necessarily the most important component in terms of ensuring a healthy population. And so we focused in on the social, the economic, the environmental, and we added Aboriginal First Nations determinants of health as well. Our fifth point, our fifth recommendation, dealt with paying attention to Canadians who are at the greatest risk of falling behind. And in particular, we looked at Aboriginal First Nations health. Our sixth point was that we think health. Health in all policy is a concept in various iterations that's been around for a long, long time, and it's one we felt was in need of being part of our action plan. Our seventh point was that we must ensure quality and we must ensure safety in our healthcare system, something which, of course, you're dealing with today. We need to prepare the providers, which was our eighth point, and I must say the Canadian Nurses Association and the nursing deans across Canada are doing that just now with respect to curriculum. And finally, we have to use technology to its fullest. We'll have a chance, no doubt, to discuss that either myself or with Anne Sutherland-Bowles, the CEO of the CNA, who's here at some point today or later, tomorrow when she speaks. But for the purposes of this panel, I'd like to add my own thoughts based on my experiences with the National Expert Commission about how I see we can improve quality through the use of digital health. I see at least 5 key current opportunities open to us thanks to the work that you have done and that has been funded and encouraged by Health Infoway. First, we have reached the stage where we can demand and establish compatible systems and processes, not just for use by doctors, but by all those working within the health system and the medical and social services systems. If we do seize this opportunity, I believe that coupled with new ways of addressing the current and future healthcare needs of Canadians will finally be able to be developed in a way that assures patient-family approaches to the many types of care that Canadians need, and to do so within their communities and in the homes within which Canadians live. Second, we have reached the stage where we can now provide up-to-date training of health and medical care providers. These tools and these systems will only be effective, though, as the people who are using them and have been trained to use them properly. Third, we have reached the stage where communication in the health and medical care setting can become a two-way street, both internal to the health and medical care teams, institutions, and patients, and from the patient to these institutions and individuals in return. This is a radical opportunity not to be underestimated in terms of achieving quality. Fourth, we have reached the stage where the key issues of regulation and legal enforcement can be addressed and resolved. This can take many shapes, including requirements for everyone to work within systems that have been shown to be effective to improve quality and to provide better health, better care, and better value for Canadians as patients. And finally, we have reached the stage where federal, provincial, territorial cooperation and coordination can be cemented, building together on the lessons that we've already learned from each other's innovation, research, and best practices to create real and integrated action in a pan-Canadian way. I'm convinced that all of the meetings hosted by and projects funded by Health Infoway have shown how our system needs and patient requests share more similarities across the board and across the nation than differences. And so I hope now we have a real opportunity. Indeed, we have a real responsibility to act.